Hello everyone, I am Vishwanath and today we are into a very important topic, and of course you get many patients in OPD about diarrhea. So how will you diagnose diarrhea and what are the things we have to know in relation to diarrhea? So it will be a short lecture, but it is the introduction to diarrhea, and afterwards we'll move on. As we move forward, we'll discuss about the management, about the pathogenesis, about the organisms causing and all, about the viral diarrhea and all. Okay, so this is an introductory lecture, and in this lecture, we define diarrhea. You all know that it is a passage of loose stools. Okay, three or more loose stools in excess of the usual habit. Let's say a patient is there, patient A is there, and its usual habit is about two stools per day. So it is a passage of three or more loose stools. Okay, so here in the definition, the stools must be loose and three or more, like more than equal to five stools, will be considered as diarrhea for the person, right? So it depends upon the person to person. It varies from person to person what you call the diarrhea. Okay, and in OPD you don't have to go into that perfect definition. You have to just know loose stools in excess habit, right? So diarrhea according to WHO is defined as the passage of three or more loose or liquid stools, loose or liquid stools in excess of the usual habit, in excess of usual habit of the person. Okay, and it can be also defined as any stool which is weighing exceeding 200 to 250 gram per day. Any stool which weighs more than, you can consider 200 or 250, 200 or 250 grams per day, is considered as diarrhea. Easy? Yes. So diarrhea can be, there may be various classifications of diarrhea, right? You can have on the basis of time period, on the basis of duration. Let's classify diarrhea. Classifications are there. So you can have various classifications. Let me first classify on the basis of duration. On the basis of duration. So we can have acute diarrhea, we can have persistent diarrhea, or we can have chronic diarrhea. Three classifications are there: acute diarrhea, persistent diarrhea, and chronic diarrhea. Acute, persistent, and chronic. And this classification is based upon the duration over which the diarrhea is occurring. So less than 14 days is classified as acute diarrhea, right? 14 to 30 days is classified as persistent diarrhea. And if it is more than 30 days, then it is classified as a chronic diarrhea, right? Less than 14 days. My video is buffering, so please manage. Then persistent is 15 to 30 days, up to 15 to 30 days. And more than 30 days is classified as chronic diarrhea, right? So acute diarrhea may have infectious causes, like there may be viral infections, there may be parasitic infections, some drugs may cause diarrhea, food infections, right? Food poisoning and all, right? These all can cause diarrhea. These all can cause acute diarrhea. Some post-infectious diarrhea, like the example persistent diarrhea, example you can say infection by Giardia is an example of persistent diarrhea. So it is a post-infectious diarrhea. And this chronic diarrhea is present in the person of IBD. You know IBD? Inflammatory bowel disease. Like it may be present in a person of malabsorption, right? So IBD, malabsorption, these all are the causes of your chronic diarrhea. Understood? So on the basis of duration of classified diarrhea, And on the basis of the pathophysiology of diarrhea, there may be various mechanisms of diarrhea. What is the pathophysiology of diarrhea? So, just a common statement which I will give for diarrhea. It is a disturbance in water and electrolyte balance. This definition is simple, yet it is very powerful. It is a disturbance in water and electrolyte. So there is a change in equilibrium or a disturbance in the equilibrium or in the homeostasis between the water and the electrolyte levels, right, in the intestine. Understood? Video is there's a lag in the video, so you can just ignore it. Just a minute. Okay. I hope there will be no more lag. Okay. Okay. So I was talking about the pathophysiology of diarrhea. Let's go in toto about the pathophysiology. About the general pathophysiology. If I talk in general, it is a disturbance in the water and electrolyte balance that is a defect in the absorption defects. It is an absorptive defect in the intestines. It is again classified into various types. I told you that there are various classifications of diarrhea. So on the basis of this pathophysiology, even we can have classifications of the diarrhea. So first one, the first, so we can classify based on this. The number one is the osmotic diarrhea, right? Osmotic diarrhea. So what are the examples of osmotic diarrhea? Like you can have what lactose intolerance, like that. Okay, and you can have sorbitol accumulation of these all things are osmotic diarrhea. Means unabsorbed solutes are retained in the water, is retained that okay. Let's see. You can have like this. Let's say this is the my video is getting very blurred. So I am just stopping the video and just teaching like that. Okay. So I was telling you that on the basis of osmotic diarrhea, we can have osmotic type of diarrhea, right? In osmotic type of diarrhea, this unabsorbed solutes are retaining water in the lumen. So this is the intestine. Let's say some solutes are present in more concentration, more solutes, and these solutes are dragging water inside. The solutes are dragging water inside. So these are retaining the water. Retaining the water. So this is an example of osmotic diarrhea, right? You can have the second one is the secretory diarrhea. Secretory diarrhea. So secretory diarrhea is basically due to increased secretion or decreased absorption of electrolytes and water. Okay, and in which cases it is there? In case of cholera, in cases of carcinoid syndromes. These are the cases in which there is a secretory diarrhea, right? Then third one, we can have inflammatory diarrhea. Inflammatory diarrhea. Inflammatory diarrhea is due to mucosal damage. Let's say we can have this is the intestine and we can have the damage to the mucosa. So let's say there is a damage here. Due to this, there is a space which will be created over here, and this space will be filled with, of course if there is a damage, then inflammatory cells will be coming. Let's draw the inflammatory cells in blue. This is the inflammatory cells, WBCs. There will be bleeding, so RBCs. This all will be filling, and this all will be increasing the osmolarity, and this increased osmolarity is again dragging the water inside. Okay, so in which cases there will be inflammatory diarrhea? Example is IBD, inflammatory bowel disease, and infections. Which infections? Infection majorly by Shigella and some types of E. coli. Okay, so first one, on the basis of pathophysiology, we can have osmotic diarrhea, we can have secretory diarrhea, we can have inflammatory diarrhea, and we can have the fourth one is motility related diarrhea. Motility related diarrhea, right? So in motility related diarrhea, basically there is an alteration in the intestinal transit. Means if this is the intestine, right, absorption is occurring, so there is an alteration here, there is a alteration here, or there is increased motility of the movements, of intestinal movements, and this is reducing the transit time, and reduction of transit time is basically causing diarrhea. Example is diabetes, right? So on the basis of pathophysiology, you can have this type of diarrhea, these types of diarrhea, and let's talk the infectious and non-infectious types of diarrhea. So diarrhea can be classified into two major types. One is called the infectious type of diarrhea, one is the non-infectious type, right? So infectious types of diarrhea, what types we have? We can have viral diarrhea, we can have bacterial diarrhea, we can have parasitic diarrhea, right? And non-infectious types, you can have diarrhea due to malabsorption, you can have diarrhea due to inflammation, some endocrine causes, or some medication related, right? You can have these types. Okay, so what are the viral causes? Just remember two major viruses. We can have rotavirus. Rotavirus is the most common cause of diarrhea in children. You can have norovirus. Other causes are there, others, I'm writing others, and in others you can write astroviruses, calcivirus, sapoviruses, adenovirus 41 strains. Okay, these are, and also coronavirus, right? Bacterial causes, you can have E. coli, where you can have ETC and EHEC. I will tell you what is ETC and EHEC in subsequent videos. Shigella, Salmonella, Vibrio. In parasitic causes, you can have Giardia and Entamoeba, Giardia lamblia and Entamoeba histolytica, and some coccidian parasites. Some coccidian parasites are there, and the examples are, in coccidian parasites you can have Cryptosporidium, cyclospora, okay, and cystisospora. So you can remember cryptosporidium for coccidian parasites causing diarrhea. So these are the etiological agents, you can say etiologies for diarrhea on the basis of diarrhea on the basis of etiology. And non-infectious causes, I told you, malabsorption. Malabsorption may be due to various diseases, like we can have let me write it in blue. Celiac disease. In case of pancreatic insufficiency, okay, you can have malabsorption related diarrhea. Inflammatory diseases, like you can have Crohn's disease and ulcerative colitis. Endocrine causes, you can have Addison's disease and also in BIPoma. And due to medications, you can have some antibiotics causing diarrhea, right? You can have some anti-cancer drugs, you can have some laxatives, antibiotics, laxatives and anti-cancer drugs causing diarrhea. So this slides encompasses all the etiological agents having diarrhea, and in the next segment of this we'll go into a little bit more detail about diarrhea. So this is a lecture 1 of the introduction to diarrhea and the classifications and the etiologies of diarrhea. So that's all in today's lecture. If you have any doubts, you can just DM me on Instagram, okay, and you can join this Telegram channel, right? So that's all in today's lecture. Let's meet in next lecture. Thank you.